All right, so this one's updated with the new epidemiology reports too, some newer stuff. So what's the function of the valves in the circulatory system? And mostly we're focusing on the ones in the heart. But where else are there valves? Do you guys know? Other than in your heart that are in your circulatory system? In your veins, in your veins, in your veins, to keep it moving back towards your heart. It's almost like an escalator type system. But it's again, just like in your veins, it's to direct the flow, right, of blood through that system, is why there are valves. Otherwise, when you pump, it would just come back, right, into that section. Your lymphatic system, we've already talked about this, right? This is more of your drainage system. Right, picks up all the excess fluid and filters it, remember, through the numerous lymph nodes before it goes back into circulation. So these two are linked to each other. Right, so we want to keep that flow just in one direction with those heart valves. And we want to get that fluid that comes out during inflammation back into circulation, but again, we got to filter it before we want to trap anything. Remember, your spleen filters what? Your lymph nodes filter lymph. What does your spleen filter? You can actually live without this organ. It's one of the few. Huh? No, what does it filter? So we have lymph is filtered by your lymph nodes. What's another fluid of your body that would need to be filtered that your spleen would do it? Your blood. Your blood. Your blood. All right, so your blood is filtered as well. Okay, and that's the job of your spleen. If you don't have your spleen, though, you don't have that level of protection. It's not vital. You can live without it. Right? But it leaves you more susceptible to bloodborne pathogens, right? Because your blood itself is not being filtered. Some of the other functions of your spleen automatically get taken over by your liver, right? When you lose your spleen, if you should lose your spleen. But they don't do spleen transplants. So what's the pathogenesis of subacute bacterial endocarditis, right? So what's the path, right? How is it that we end up with this type of infection? So normally, it's your normal flora, right? So your normal flora that gain entrance into the bloodstream. And the most common entry point is when you have dental procedures done. Because remember, you have bacteria in your mouth. Remember that plaque associated with your teeth is actually bacteria. It usually only creates problems, though, for the heart is when you have an abnormality in the heart, right? You have damage to the heart, the inner lining of the heart. Mostly it's the valves that are going to create the problem, where you have turbulent flow, and they're more apt for these bacteria to be able to take up residency within the heart, right? So this is an infection within the heart. Biofilms can develop right where they're sticking in the inside. And the problem here is because of the flow and everything, it's hard for white blood cells to get to it, right? Because of the functionality of this organ. And then pieces from inside the heart can break off and, of course, enter into the bloodstream and go to other parts of the body and block blood vessels, right, which can lead to tissue death. So the people that are at risk for this, right, who have some abnormalities to their heart, like people who've experienced rheumatic fever, situations where you have large numbers of bacteria in your blood, bacteremia, leave you more susceptible to these types of infections. And so I don't know so much anymore, but a lot of times people who have heart problems, heart valve problems with their heart, before they would go for dental procedures, they would have to take antibiotics. And so that way the bacteria that would get in during the dental procedure when they're scraping, right, and cleaning your teeth, scraping the plaque off, if they hit the gums and anything gets into your bloodstream that way, you'd be protected already because you'd already have antibiotics in your system. I don't know to what extent they do that anymore. Some people have told me they don't do it. I think it's a conditional basis. It depends on the patient, their history, and their situation. But that's why, dentists will ask you about your health as well, right? You were wondering sometimes, but all these things are linked, right? And can affect you. So another thing that can happen is endotoxemia. And so endo means from within, tox referring to a toxin, emia refers to in your blood, right? So this is when you have toxins circulating in your blood. And this is typically usually caused by gram-negative bacteria because they're the ones that have this specific endotoxin. So sometimes it's also referred to as gram-negative septicemia. Septicemia, again, referring to that the infection is in your blood. So individuals will have violent shaking, chills, and fever, often accompanied by anxiety and rapid breathing. They could also go into what's referred to as septic shock. So this is when it's widespread infection. Urine output is going to drop. Respiration and pulse become more rapid. Arms and legs become cold and dusky colored. And this is because you're not getting perfusion of blood, right, to the extremities. And we're limiting the amount of loss of water. That's why the urine output is going to drop. That's one of the ways we conserve water, is not to urinate. Which eventually you do need to do that, right, to get rid of those toxins, to get them out of your body. So the respiration rate, too, is trying to maintain balance, pH balance, and so that's why the respiration rate changes. So I said gram-negative bacteria, the most common cause of fatal septicemias. Shock is very common despite treatment, right? And this is the problem of this toxin circulating through the blood. So mortality rate is nearly 50%. The most common gram-negative offenders are E. coli, which we know is could be part of our normal flora that could be introduced, unfortunately, into the blood system. Pseudomonas aeruginosa is another one found in our natural environment that you could get an infection that could get into your blood. And lots of Bacteroides species. And again, these are ones that are part of our normal intestinal flora and even our upper respiratory flora. So if you have a serious infection to the level that it gets into the blood, right? This is when it's circulating, the pathogens are circulating in the blood. And so I had a colleague of mine here at Delgado, he's in the business department, and he had a real serious infection and it went septic on him, and he was in the hospital. And he obviously survived because I got to talk to him about it afterwards. But he teaches business. And so he says to me, he's like, wow, I really appreciate the stuff that you teach now. And I had no idea how close to death I was at the time, how scary of a situation that I was in. He goes, I have a better understanding of it now, and I'm very grateful to be here. And he's right, because like I said, really high mortality rate, even with treatment, right? Because sometimes it's just to the level where we really can't treat, right? And so the problem with this is it generally originates outside the bloodstream, right? So some other infection somewhere, but and any number of things and it could be our normal flora, right? Our defenses are low and allow the organism to infect into the blood. The endotoxin is released. Now, antibiotics can enhance this. You're like, what? Right? So it's like you have an infection in your blood and we give you antibiotics and we actually make you sicker, right? And this is why, like sometimes treatment, depending on what stage you're at, is actually going to make things worse. Right? You think, oh, he's got a bacterial infection, we can just throw antibiotics on him and they'll be better. The problem is that the endotoxin then becomes released as these cells die. Endo means within. So it's the lipid A component of the lipopolysaccharide of those gram-negative bacteria that gets released when they're killed. Macrophages respond intensely to this, right? And endotoxins too can really cause a really aggressive response, right? A really almost hypersensitivity response. Failed localization is what allows the toxins to then get into the bloodstream, right? So if we have a local infection, right, and we're not able to maintain it, and then those toxins get into the bloodstream, and then, we've got widespread problem now. Lungs particularly are very susceptible. And again, damage to our lungs is irreversible. And then, as I said, often death will result even despite treatment. So what are the things that get activated that usually lead to the shock that we're dealing with? So we've got these gram-negative bacteria. They're being killed, whether by antibiotics or by our immune system. The endotoxins released can activate macrophages. Remember, they can elicit lots of different types of responses. They're going to cause even more leakage and inflammation. They're going to cause neutrophils to come to the area. It can even cause fever. Decrease in muscle tone of the heart and the arteries will happen, right? So you have this dilation. Complement can become activated, right? And so we have more inflammation, right? Leakiness. And this lung tissue is particularly susceptible to this type of cascade of events. More white blood cells coming into the area, more enzymes released, and we have destruction of our own tissues. Clotting can become activated. And so we have disseminated clotting throughout, right? So we can end up with tissue damage because of the clots forming in the capillaries and the blood not getting to where it needs to go. And then when we need clotting to happen in other areas, it can't happen because we've depleted it all in these other areas. So mainly a problem for people in pneumococcal situations, hospital situations, people that are already relatively sick, and then you have it go into the bloodstream. Generally tends to increase the disease that relates to the increase in lifespan, right? So the older you are, antibiotic suppression of normal flora that would keep stuff in check. People who are immunocompromised, who take immunosuppressant drugs, right? So people who've had organ transplants, right? So they don't kill off that organ, they suppress their immune system, and this leaves them more susceptible to something going septic. As well as, remember, medical devices can form these biofilms. Those could be the source of infection that could spread and go septic, right? That's the scary thing about that. So prevention and treatment largely depends on quickly identifying of infections, right, and properly treating it when it's localized before it gets to the bloodstream. Treatment against the causative agent. So again, there's lots of different bacteria that can cause this, so we have to make sure we're also targeting what is actually causing the infection. And because of that, treatment options are going to vary. So the next is two diseases that can infect, and they have very similar attributes to them. So we're going to look at Tularemia and Brucellosis. And we're going to focus on their epidemiology. So how are they transmitted? Where does it come from? How do you get it? So Tularemia, another name for it is rabbit fever. And one of the reasons behind it is that, hunters that hunt rabbits would sometimes get this bacterial infection from the rabbits. So it is a bacterial infection for both cases. They are gram-negatives. So rabbit fever, it's present among wild animals, right, in most of the United States. The risk is mainly, of course, to hunters and trappers, game wardens, and others who handle wildlife. Mucous membranes or broken skin is how it penetrates into us. So if, as they're skinning the rabbits, right, they could become infected as it becomes aerosolized, or they could inhale it, right, or could get into a wound if they have it. Another way that it can be transmitted is the bite of an infected insect or tick. And then, as I said, occasionally could even be inhaled. So apparently do have vaccination for individuals who are at high risk. I've never actually heard of anyone being vaccinated for tularemia, though. Mostly, of course, you want to avoid biting insects in general for many different diseases, but this is one of them. And really, a lot of people don't wear protective gear when they're slaughtering animals, right? Rubber gloves, mask, right? Protect the mucous membranes, safety glasses, right? To really help minimize the entry into our bodies. It can be treated with antibiotics. And the organisms are ingested by our phagocytic cells, but they grow within these cells and then spread throughout the body. So this is the bad news, right? It can go system-wide. And then brucellosis, the main source of infections is domestic animals. So we're not dealing with wild animals now, we're dealing with domestic animals. But it does occur in some wild animals. So moose, caribou, bison, the buffalo in Yellowstone National Park. There's been for several years a vaccination program to vaccinate them. Of course, farmers, veterinarians, those who are exposed to or drink unpasteurized milk are also at risk, right? So this is one of these things that can be passed in the milk for these animals. So one of the ones, so of course this is listing some wild animals, but the population of animals that we're most concerned about here in the United States is cattle. So they can be infected, and the bad news with this is that for them, when they have this infection, it causes abortions. So it could wipe out a whole herd. It's highly contagious, and it's transmitted in the milk, and so humans can get it that way. But this one's actually listed as a bioterrorist agent. In order to work in research, you have to go through a thorough background check. There is a lab that works on brucellosis at LSU, and it's like under lockdown. And the reason for this isn't so much the harm to us directly, but the harm to a major food source for the United States, and that would be our cattle. I mean, if somebody introduced this into a cattle herd, you could wipe out the entire herd, okay? So they work very hard to maintain the status of brucellosis free for cattle ranchers. And they do have vaccination for it. And as I said, they've been trying to vaccinate the bison in Yellowstone National Park. And part of the reason for that is not only to protect them and preserve them, is if they get out of the park and they get to local ranchers, they could spread the disease that way as well. And a local rancher, if a bison gets on their property, they'll shoot it immediately for fear that it may have this disease and spread it to their cattle because it's so contagious. So as I said, we do vaccinate our domestic animals, and they are trying with that population of bison in Yellowstone National Park to also vaccinate them. We pasteurize our milk to help protect us against this infection as well. It doesn't have the same type of infection for us. It doesn't cause abortion like it does in cattle. Goats as well can get it. Pigs too can get it, and it causes abortion for those as well. Dogs, cats can also get this, although it's of a major concern, like I said, for cattle in the United States. So the organism penetrates the mucous membranes and can be carried to the heart, kidneys, and other parts of the body via the bloodstream and lymphatic system. They are resistant to phagocytic killing and grow within these cells. So the bad news with that is that it can go, system-wide for us. So it can be a quite serious infection. It's the other name that's for is undulant fever, because people tend to have periods of fever and then it subsides and then they get fever again. So it kind of is this up and down cycle of fever. Again, because since it can get into the lymphatic system, right, it can cause enlargement of the lymph nodes. And people can recover without treatment. So for tularemia, it occurs among wild animals mostly in the northern hemisphere of the United States. The easternmost usually occur in the winter when hunters are skinning rabbits, hence its nickname, rabbit fever. In the western part of the United States, we tend to see it more in the summer months when people are out and they're exposed to biting insects like the fleas and ticks that may be carrying it from the wild animal population. So other reservoirs to be noted, muskrats, beavers, squirrels, deer, right? So a lot of wild animals can carry this bacterial infection. So this is a comparison between 2 years, 2007 and 2008. And you can see it's kind of sporadic, right? There are some kind of focal points here, right, in this region of the country, but not a lot of reported cases. Most of the time because hopefully people are being cautious, right? It's when we're not cautious when it comes to infectious disease. So again, this is for 2012, and again, the focal point seems to be in this region here, right? We need some education here, but not, huge numbers. For brucellosis, again, when you look at this one, what did I say? One of them, what's majorly going to have this type of infection that we worry about, and therefore could be transferred to humans? What's the major food sources affected by brucellosis? Milk, cattle, right? So what are the two highest per capita of cattle raising states in the United States? The numbers tell you. Texas and California, right? So the most cattle, therefore these are human cases, right? But your likelihood of getting this infection greatly increases the more exposure you have to these animals, right? So these are our big states when it comes to brucellosis. So as I said, common in cattle, even sheep, goats, and it presents a significant risk. And so it's also been documented in feral swine in Florida and California. It makes me wonder about the problem we have here in the Atchafalaya with the swine they're trying to eliminate too. So again, see the trend continues. That was an older one from 2007. 2012, what are our big states, right? California, Texas, and Florida too, so up there. So they said Arizona, California, Florida, Illinois, North Carolina, Texas account for 3/4 of all reported cases. And again, it just has to do with the fact that they have a larger number of cattle, so therefore a greater incidence. So the incidence of brucellosis in the United States increased slightly from 2003 to 2007. In 2008, a number of cases were reported to the CDC to decrease, although brucellosis in cattle is in the final stages of eradication, right? So we're trying to completely eradicate it from cattle. The problem is the disease persists in feral swine. Elk was one of the ones I hadn't mentioned, and then bison in Yellowstone National Park. And so this increases the risk of transmission to hunters and to animals in general. Outside of the United States, brucellosis remains endemic, right? Where they have lots of areas where they just have really large numbers of it. Mexico and the Mediterranean region, which again, of course, poses a risk to travelers who consume unpasteurized milk products and some soft cheeses. And so when my ex-husband was deployed to Afghanistan, they went out in town one day and they had a soft serve ice cream machine, and it said, American ice cream. And one of his friends had the biggest sweet tooth. And he runs right up to the machine, and he thinks he's going to get him some ice cream. Thank goodness he was with my husband. And he said, what are you doing? He's like, it says American ice cream. He's like, really, Cody? Really? You think the milk came all the way from the United States that they put in that machine? Not likely. It came from the goat farm we just passed down the road. And they don't pasteurize. So you're not going to eat that. Unlike several other individuals who ate it and then got sick. And they may not have gotten brucellosis, but there are other bacteria, right, that most of us are not used to our immune system being exposed to because we drink pasteurized milk, right? Where the people there commonly drink unpasteurized milk, so they have developed an immune system, right, that can protect them against most things, right, including probably things like brucellosis. The other one you have to worry about with unpasteurized milk is tuberculosis, right, and then other bacteria in general. So we've seen these periods of increase and decrease and the number of reported cases of brucellosis throughout the years. But nothing, significant within the human population. Now, it's caused by Brucella melitensis is the species name. At one time, when they were first discovering this disease, they thought there were different species that were inhabiting the different animals. So, of course, it was Brucella abortus because of the problem of causing abortions in cattle. But in fact, it's the same genus, right? So instead of having all these genuses, like Canis was referring to brucellosis in dogs, melitensis was actually the one given for goats. Why they picked that particular genus name, I don't know. Species name. But if you see these other names, it is all the same species. They've done genetic testing and stuff now, and they found that it isn't a different bacteria that infects goats, pigs, sheep, whatever. It's all the same. And so they've decided on a single species name of melitensis. But sometimes you'll see the other names in the literature still. So it's a chronic infection in domestic animals, generally involving the mammary glands. This is why it can be passed into the milk and, unfortunately, the uterus. And so this is why it can cause abortions. Although abortion, as I said, is not a characteristic for human disease. It occurs, of course, workers dealing with the meat packing industry as well as the dairy industry. And so it can create a major problem for us for the fact that we use these animals for food. So that brings us to other categories within bioterrorism. So the plague is listed as a category A bioterrorism disease, where pretty sure brucellosis is B. What A means, if something is put in the A category, the agent poses the highest risk because they're easily spread or transmitted from person to person and results in a high mortality rate. So the problem with brucellosis isn't its effect on us, but the indirect effect, in killing cattle. In the case of plague, on the other hand, we're talking about mortality to us, easily spread among people. And most people don't hear about plague anymore, right? So you think that it's gone. Not the case, right? Sometimes it's also referred to as the Black Death because the infection, right, will cause a blackness. So it's caused by gram-negative bacteria, Yersinia pestis. It's an encapsulated bacteria, and it has multiple plasmids. Remember, these are circular pieces of DNA separate from the chromosome. And this information, unfortunately, is not so good because it gives it some of its pathogenic ability. So why is it so lethal? Why is it called the Black Death? So masses of the organism obstruct the digestive tract of rat fleas. These fleas regurgitate the infected material into a bite wound, right, when they're biting you. And the problem, too, is because it obstructs, and notice the blackness associated even for them with their gut. Because it obstructs their gut, they're hungry. So they bite even more and transmit even more. And then PLA is a particular virulence factor that these guys have that are essential to the spread and the entry at the site. The organisms multiply within our macrophages. So this is the bad news, right? Our macrophages gobble them. They're supposed to kill it? Nope. They can't kill it. And even worse, when they get inside the macrophage, this activates them to produce a capsule, right? So the F1 capsule is produced when they're in the macrophages. Then the macrophages die and they bust out, right? They're released from the macrophages. And now they're encapsulated. So it's even harder for us to phagocytose them because it's hard to recognize them. The Yopes proteins and other mechanisms then enhance survival. Inflammation in your lymph nodes results in the characteristic swelling that people see. Nodules become chronic and spill the organisms. And this is referred to as septic plague. Mortality rate of untreated reaches 50 to 80%, hence why it was called the Black Death. The good news is a bacterial infection, is it not? We know how we get it, right? Avoid fleas. So it's endemic on rodent populations in all continents except for Australia, lucky them. Now, I mentioned rat fleas, but things like prairie dogs, rock squirrels, and their fleas are the main reservoir. Hundreds of fleas can transmit plague and can remain infectious for a year. And even their poo, right? So in the bedding of these animals is infectious from the fleas. It can spread person to person by household fleas. Right? So bite one person, transmit it to the next person. The organism can remain viable for weeks in dried sputum, right, which is spit, and the flea's feces, right? So yucky, yucky. So how do we prevent and how do we treat? How do we prevent? We usually, the most common offenders in cities was rats. So it was a major control of rat populations. Proper garbage disposal, rat-proof buildings, guards on moorings for ropes for ships, right, to keep it from getting on ships and spreading, extermination programs. There is a killed vaccine that gives short-term partial protection. And then treatment is, of course, antibiotics, tetracycline for those that have been exposed to control epidemics, and they'll give gentamicin or Cipro or doxycycline are all effective if given early. Right, before it gets too bad. The really scary thing with this one, I don't think I have it on this slide. Do they talk about it here? Yeah. So the lungs can also get infected, right? So normally you could get a bite, but if you inhale like the feces or the sputum, and you get an infection in your lungs, that's referred to as pneumonic plague. And that's really scary. And that's the one that really is terrifying as far as plague goes, as far as spread. Because that can be very easily spread from person to person by respiratory droplets, right? Pneumonic plague, where it, of course, causes a pneumonia. And this is highly lethal as well. And that element of easily spread goes up dramatically when you're talking about something being aerosolized. All right, we'll stop frightening ourselves. Okay, so we'll talk about good old mono. This will probably be our last one. So outline the pathogenicity of the infectious mononucleosis. So how does it make us sick? And describe how infectious mononucleosis is transmitted. Anyone know the nickname for mono? Kissing. The kissing disease, right? Because it's transmitted via saliva. So for some reason in the United States, not very common among adolescent, young. It's more common in adolescents when we start kissing one another and we start sharing drinks and things like that, right? So junior high and high school is when you usually see outbreaks of this. And this is actually caused by a virus, the Epstein-Barr virus. And it is a DNA virus, and it is in the herpes virus family. So epithelial cells of the throat and your salivary ducts become infected. And then latent infection, it hides in your B cells and your B lymphocytes. Activation of your B and T lymphocytes happens. And this is one that can cause hemorrhage from enlarged spleen and it's a rare but pretty serious complication. So I remember for athletes in high school, this is a big no-no because that enlargement of the spleen, and especially if you're doing contact type sports, it could get ruptured. And so they worry about that. And then in general, the people who are sick with this, severe fatigue, they experience fever, sore throat, and enlargement of the lymph nodes happens. And as I said, spread via saliva. Lifelong recurrent shedding of the virus into the saliva by aseptic individuals is how it stays endemic in our population. And latently infected in individuals. So this is a herpes virus, right? So once infected, always infected. But again, your body usually gets control over it, right? And quiets it down. But look at the incubation period, 1 to 2 months. So I mean, figuring out maybe who transmitted it to you can be difficult depending on the situation. So why is it called infectious mononucleosis? So remember, the mononuclear cells, right, having one solid nucleus are your B cells and your T cells, right? So these numbers significantly increase when they look at a person's blood because of this infection. So appear after a long incubation period, right, can be months to 2 months. Symptoms include fever, sore throat, covered with pus, fatigue, enlarged lymph nodes, and spleen. Most cases, the fever and sore throat will disappear within 2 weeks, the lymph node enlargement within 3 weeks. And again, you'll see a lot of the mononuclear cells on a blood smear, then you'll see our neutrophils that we're used to seeing, right? These will outnumber them. Yeah, so just a repeat of what we've gone over. Virus activates B cells to produce multiple clones, and the clones produce immunoglobulin, right? So this virus is actually causing our cells, right, to activate that aren't supposed to be activated, and they produce antibodies. So whatever antibody it is that they're able to make, they make it, whoever is activated, and it's a random thing. The weird thing about this is it's what they refer to as a heterophile antibody. These antibodies tend to, what's the word I'm looking for? Interact with other species antibodies. It's a weird thing. So it'll hide out in our B cells, and they're not attacked. It's distributed worldwide, infects individuals in crowded, economically disadvantaged areas, infects them in an early age without producing really serious symptoms. More affluent populations, like here in the United States, they usually miss this exposure and lack immunity, and so it occurs, as I said, exclusively in adolescents and adults that lack the antibodies against this particular virus. The virus is present in the saliva for up to 18 months, right? So mouth-to-mouth kissing is an important mode of transmission. But also sharing drinks, right? This is swapping saliva. There's no known animal reservoir, so it is just humans that are harboring this infection. So avoid saliva of another person. There's no vaccine, and there are some antivirals, but of course this is not going to affect the latent phase. This is only during the productive phase when it's actually busting out and infecting more cells. And that's probably attributes to the severe fatigue that individuals tend to experience with this type of infection. Do we want to bust through yellow fever? Yeah, we'll finish up with our viruses. So yellow fever has not been eradicated despite the availability of an effective vaccine. So what's the problem here? Right? So if we have a vaccine, why can't we just get rid of it? Right? And actually, we don't have it here in the United States. And one of the reasons why it's called yellow fever is that the virus can spread to the liver, but it also can affect the red blood cells. And because it affects the liver can't process the bilirubin, which is what causes the yellow pigmentation. So that's why it's called yellow fever. But the epidemiology is going to give us a clue to this, right? Where does it come from? So the virus persists in forest primates and the mosquitoes that feed on them. So in Africa and Central and South America, human epidemics occur when the virus infects household mosquitoes that feed on humans as well, right? What's the good news for here in the United States? We don't have these large numbers of forested primates harboring this virus. We've got mosquitoes, right? There is the potential for yellow fever here in the United States. The other interesting thing for this one where is it? Oh, they don't talk about it in this one. This virus actually has to grow in the mosquito before it can be transmitted to people. So there's this time lapse, right, where if they bit somebody and got the virus and they bit someone else right away, you won't get it. I can't remember the time frame. They don't have it on here. So whenever you have, and this is a twofold, right? So we've got wild animal population, that's difficult to control, and we've got what's called a vector spreading it, right? The mosquitoes. That's also trouble to control. So you have two populations here that you would potentially have to control to eliminate this virus. So it makes it next to impossible. Even though we have a vaccine, eliminating it from the wild animal population and the mosquitoes is an insurmountable task, right? So I think all we have left is malaria, and that's a protozoan, so we're going to leave that one for next time. Don't forget to look on Blackboard. I'm going to post that listeria case study. Make sure you read through that, and we're going to go over that in class as well as finish up malaria on Friday.